This is another very good presentation because, again, I haven't actually seen it as much as what it is. You tell me what it is, you want to remove it, I'll do it. I don't know, I just assume that you've went there to your doctor and they said it's okay. But even the doctor can actually... Number one thing, make sure that mole is not dangerous, amphilasma, but if you're dealing with amphilasma, you're just leveling them off, you may require other treatments. This is 10 days after, 14 days the scab fell off. It's still This is another very good presentation because, again, I haven't actually seen it as much, but I think I've seen it once. It's mole removal. Mole removal is very important because, as I said before, all of a sudden you're actually disrupting the poor doctors. You're taking their job away. What the hell? I mean, they used to go to dermatologists to remove a mole. Now you can do it quite easily with these devices. And not only can you do it easily, but you get very good results. Number one thing, make sure that mole is not dangerous. It is not your job to establish that. This is why for several years, in my perspective, for a number of years I said, no, only doctors do it. It's because originally you want to make sure that the mole is benign and have it removed. But if it is benign in Europe, anyone can treat it. So the sort of thing that we have developed is, in the consent form, you make sure that that person is aware that you cannot provide any diagnosis. You're not a doctor. They can ask you to remove whatever they want to remove, and you'll remove it, but you make no diagnosis. And they are supposed to have that mole looked at by a dermatologist in advance. So if something happens, you should be covered. You should be covered. However, it's a good idea to have a look at the rules and try to realize what a bad mole looks like, because they're quite relatively easy to identify a bad mole. But just make sure that that thing is benign, and in the consent form that we've got, we address that really, really well, I'd say. Now here we've got a number of case studies, a few of them which we talked about. So originally the first way of removing moles is by using a scalpel. A conventional scalpel is not the best way because obviously you're extremely likely to get a scar one way or another because you're not as precise with the scalpel. Then we have the lasers. All of a sudden we've got lasers for skin treatments, and these have been historically quite expensive to remove with lasers because lasers are expensive. Not only are they expensive, but they're not easy to use. So you require a specialized training in order to use them effectively. And what is extremely easy to remove with one of these devices becomes more difficult with a laser because they're more expensive. You need training in order to, extensive training because they've got loads of parameters depending on the lasers that you're using, the type of laser that you're using. Namely, normally what you want to use a CO2 laser for tattoo removal. And this is why they call these devices a portable CO2 laser, because many of the things, including tattoo removal and skin tightening, again, you get comparable results with CO2 lasers, which are normally quite expensive. Then we're seeing some moles removal using our device. We've got to make sure that the moles are benign. And then we're going to see some case studies and some things that we've seen before.
Can I just say something? And I'm not an expert, please don't quote me, don't say, but you said we could know. I'm just talking from my own personal experience. I was in consultation in the States with a surgeon once, and he said to me, Laura, how do you identify a benign, not 100%, or a malignant one? He said, how long have you had it? Oh, no, I've had it since I was 6. Excuse me, it's benign. Okay. You know, we're sitting with the moles sitting, and sometimes you walk past people who've got these huge send her to a dermatologist. She's going to pay 400 rand for a consultation to have it identified. I know she's had it since she was 6. You know what I mean? How long have you had all these little spots all over your neck, all on up, or up here? Years. You know? A banana one comes up and it starts growing. It gets bigger and it's sensitive and it's, I mean, yeah, you know, it's not, I like that. You sort of see they like that. You know what I'm saying, guys? So don't quote me, but, you know, I haven't had any adverse reactions ever removing a mole. I started with removing moles with Rejuvi skin care. I trained my Dr. Jane himself. And he just takes it, removes the chemical, and he just takes that mole off. So don't be scared of mole removal. If you're not sure, send it to a dermatologist. But if it's just a thing that's been sitting there for years,
even though it's been there for years and it's still changing and growing later, most of the time.
oh, if it starts changing, anything that starts changing and growing, no, that's not
Yeah,
normal.
because some people say, I had this forever, but it's definitely bigger than it
It's going to be, that one have identified, for sure. Yeah.
Pray, please.
Oh, sorry, I just want to touch on that there's hair growing out of the mole.
Uh-huh.
It's not, because because hair doesn't grow in a normal.
That's a fact. My father's a doctor.
Uh-huh.
He's taken hundreds of moles with people. He's got research done, and then he always says if there's hair growing in a mole.
It's never benign.
Yeah,
This one has got hair growing on it since I was little. I mean, I have to shave it, this mole here. I haven't died of it yet. Well, hopefully. But, sorry? Yeah, I could. I like it too much. I like it too much. And
So if there's hair in the mole, I've removed it.
I like it too much. But it's this hair here on this mole. I have hair there. Yeah, I could remove it. I like it too much. I like it too much. Or not.
No, but I mean, it can be removed.
Yes, it can be removed. Yes, it can. I'm happy to have it removed, but I'm not going to.
It doesn't mean it's removed because it's got hair in it. Okay, let's...
Now, the point is, one thing I'd like to point out, I don't try to play down dermatologists or anything. Nobody, even the dermatologists, the fact that the doctor don't have the, even they don't know with 100% accuracy. So what's done up until now, when we get artificial intelligence more widespread, it's going to be done by computers. If they suspect something is not right, they chop it off, send it to do a histological examination. That was going to confirm 100% what it is and whether it's benign or not. So you cannot tell, even the dermatologists cannot tell. But they're actually, in many countries, especially, well, in Europe, where I'm more familiar with, they are the ones who are more protected. So if they make a mistake, they don't go to jail, so to speak. So, but if you're, you want to make sure that if you're a beauty therapist and you remove moles, that you're protected by your consent form, saying, I don't make any appraisal on your mole as what it is. You tell me what it is, you want to remove it, I'll do it. But I don't know, I'll just assume that you've went there to your doctor and they said it's okay. But even the doctor can actually think it's okay and don't take the serological examination, don't cut it out, don't send it to the lab, and it's something dangerous. It could happen, so nobody has the right answers. Even the guys with the right qualifications is because we're all humans. So.
And please, can I stop there? Everybody have insurance. Don't be scared when you're not insured. You get hold of Aon. We'll give you the numbers if you need to later. Just remind us. Phone numbers. Phone Aon. They insure us with medical malpractice insurance. So if something goes wrong, the account wants to sue you. They're not going to take your house away. The insurance company will fight for you. Because they don't want to pay it out, and you have got your indemnity forms.
It's so much. If you have a business, it's not a good idea not to have insurance. Even if you've got the consent forms, the reason is it makes you sleep at night. No. Because even if you have the consent form, and even if with the consent forms that we've got in place, they're very, very difficult to do anything. But this is you want to sleep at night. You want to make sure that even if they try, it's not going to be easy to ruin your business.
And it costs you about 450 rand a month on living order, covering you for about 5
Do
months.
they cover that you remove it? Because lots of insurance companies don't.
Aon does.
They do.
Yeah. So it gives you a 5 million cover for about 450 a month.
I'll give you the lady's name and phone number. You must deal with her directly because she's familiar with our brand.
Sorry,
I've got it there. And they said, no, I'm going to pay 1.5
for what?
for cover.
1.5 grand a month.
A month?
Yeah.
With Aon.
Yeah.
I signed up for recently.
You must send me an email. I think it's 5,200 a year.
Okay, we'll find out. We'll find out.
Yeah.
So let's carry on.
Yes. So once you're appraised that they're not cancerous, that's the normal way of, the traditional way of removing a mole, using a scalpel. And you can imagine this is not going to be pretty after. Very likely it's going to get a scar. Not necessarily, but you're very likely going to get a scar. And that's been done for several years, up until the lasers came about. And then when you want to do a histological examination, you just cut it as an eye, just to remove the roots, and you send it to the lab. Unfortunately, you've got a scar left, but sometimes you're better doing that way for something that's it's not particularly looking good. Then you've got lasers removal. The laser removal is very good, but again, as I said, all you're trying to do is very good. It's more difficult to do because of the training that you require with lasers, but you get the same results with plasma as an expensive laser all of a sudden. And all you're doing in most moles or benign lesions is flatten them. In the symphilasma, there are certain lesions are like symphilasma, so they're actually rooted inside the skin. Not necessarily, they're not necessarily non-benign, but you may require a number of sessions to remove them, and symphilasma is one of them. If you just flatten if you only flatten certain types of skin lesions that are benign, sometimes you have to go back to them and remove them again. So that can happen. But mostly the technique of flattening the moles with the surrounding skin, if you're not sure about what it is, just do that. But make sure there's something that is benign. There's something benign. That's very, very important. And this is actually another mole removal example. We've done the procedure here in South Africa, actually. Very nice lady. We removed loads of moles in one session, and we've got the video as well. And again, they've been flattened. The moles, very, very simple. You can watch the procedure online. And yeah, so again, the technique that uses the spray operation, our device is particularly good for it because you've got loads of power levels. The highest power level can actually remove the big bulk of the mole really, really quickly. And then as you go towards the baseline of the skin, you reduce the power level and you just make sure it's very well flattened. And you usually get very, very good results very, very quickly. And that's the advantage of having a device that's got multiple power levels and very, very high power levels. And yeah, so just some before and after. Just all you have to do is just make sure that you level it off with most moles. And so you go and burn the mole superficially. Every short spray, then you remove the carbon residues to make sure that you feel it. You know where you're working, how much you've got to remove. And then once it's flattened, you have finished. Okay, and again, aftercare and apply numbing product before you start the treatment, only for the comfort of the client, and make sure that the area is kept clean, and the scabs should form within 3 to 4 days after the treatment and fall off on their own accord. And we're going to go on to the mole removal case studies. Any questions?
That previous sentence was incorrect. Just go
Yes.
back to the previous slide.
Uh-huh.
Is that supposed to be first
Which one? This one. Make sure the mole
Is a not benign.
is a benign growth.
Should be non-benign.
Where is it? Where is it?
No, benign is
Make sure that the mole your client tends to have removed is a benign growth. Benign, good. Good, nice. It's not benign means this it's a nice, yeah, non-cancerous, yes. Yeah. I don't know. To be fair, many apologies. I don't. We'll put it on online anyway. Put it online. You can download them. I do apologize. I don't know. Maybe it's just been done. I cannot even see in the computer. I have to see.
So you will get a few moles that we're going to watch you do tomorrow, Andreas. And so you wipe it with the cotton swab. You keep wiping.
Yes. Yes. Up until you're sure that they're flattened. Any question?
All these things tomorrow.
I've had-
One is working, okay.
Yes. I've had a question, but it's not related to this as much. Somebody's asked whether the color of the arc is relevant, whether electrical arc is the same as plasma, whether they call it some people call the nitrogen plasma, and I think it's the Accor guys. I'm not sure. They keep coming up with the different things. Say no, our device is a true plasma. That device is not true plasma. There's an arc, or that is. So they come up with these different things in order to confuse people. Say, for example, they say, oh look, this plasma is blue, or that plasma is red. In reality, most of the cases, we're talking about people trying to confuse yourself. Pretty much, we've looked at a number of these devices from the Plexer to that Accor. We've designed our own, pretty much. The technology is the same. So people may try to confuse you by saying that the other guy's plasma is not the true plasma. They've got the nitrogen plasma. They've come up with many, many things. But in the reality is, in the majority of the cases, they're just coming up with something in order to keep you out of looking at the competitive devices. That's what.
Remember, if you've got an arc light coming, a plume coming out, it's a plasma. Doesn't matter what machine, what the name, what the brand.
And we shouldn't actually.
You got the plume. That's what we're looking for, a plume.
We shouldn't do that because we make our own device and we want to sell that. So we shouldn't say it, but we say it because it's the truth. This is the sad advantage of being an engineer, to realize these things. And yeah, so it's, hopefully that's quite clear. So if you don't have any other questions, I'm going to go into the case studies, which we actually talked about before, I think. And again, this particular one you can actually watch online. This is a 20-year-old at the time of the procedure. I think she was 22, 23 when I met her again. Met her again at dinner. And the result was, so okay, just go back. I'll show you what it is then, just a second. The result is there, nothing. And this is me with one of my mobile phone, taking the picture with one of my mobile phones. And it's completely seamless. And I just remember, I looked at her, did I remove anything? It's just like, I kind of remember doing it because then I've actually edited that video myself. At that time I was still doing that. So, oh, yes, you did. Oh, okay, can I take a picture? And then I've done the before and after, absolutely seamless. I couldn't tell there was something there before. I simply couldn't tell. What we've done there is, if you watch the procedure online, we used some medical practitioners still, I don't think they do it right now because of all the internet problem that we've got. Because things that are effective are actually people start to use them more and more. Historically, it were doctors only doing it, and they were using injectable lidocaine. It's an overkill. If you just use the product that we've got here, a numbing product, a good numbing product that will do the job. You don't need to inject anyone. It's just an overkill. So what we used is a numbing product to numb the area. and then we've done the treatment.
Guys, just to tell you about the anesthetic, I test all anesthetics, and Sherry's always bringing in new. She's searching the world for anesthetics because we want the best of the best, we want the numbest of the numbest, okay? So whenever Sherry brings in, Mom, I brought in 3 new anesthetics, please test them, please test them, please test them. So the first way sorry if I can interrupt,
No,
the
please.
first way I test them is on my own 2 cheeks, okay? That's why I look so young, okay? So when I do needling, I don't do dermaplane needling, I do roller. I do what I call a vampire needling, the clown pouring implant. Okay, so I use 1 millimeter roller and I do it thoroughly So I put what I've got that I know is the best now on this cheek, and I put the new one on this cheek.
For
And
myself?
then I give it 45 minutes.
For me?
Okay,
Yeah.
some
No, so for
cream
myself.
anesthetics peak at 20 minutes. I'm not talking about those. We've gone further than that and found anesthetics that will continue numbing. For example, your illness and stuff will peak at 20 minutes, and although the client feels she's dead, she's not. It's only the epidermis that's giving the illusion of being dead. She's not. She's live inside. And that's why so many people say, oh, the here. But she's like, kan ek nie glo maar my lippe is so dood van so seer. It's not just the epidermis is now. We're going inside. So what we're working with now are numbing and numbing. Now, at 45, 50 minutes to an hour, she should have a brick on her face that she feels nothing. Okay, her face should feel like a brick. All right. So that is with our F&E cream. So I put the F&E, now that is our strongest at the moment. I put the F&E cream on here. And then we've got our Ultra Numb, which is our little tube. Sorry, I didn't take it out. Okay. Our little tube is the Ultra Numb. That was the next kid on the block, which we're using now with plasma. So what I did is I did this cheek with F&E, left it on for 45 minutes, put the Ultra Numb on, left it on for 45 minutes, rolled this, never felt a thing. Rolled this, never felt a thing, with heavy 1 millimeter rolling this way, in all directions, okay? Never felt a thing. At about 7 o'clock that night, I actually took my students to dinner that night, and we were talking about, at about 7 o'clock, they said, Nor's the light back in your face set, and I said, well, this side is back, I can feel where the F&E cream was, but I'm not feeling the Ultra Numb, it's dead, it's still dead. 11 o'clock that night, I phoned Sherry, and I said, Sherry, I'm worried. It's 11 o'clock at night, I did it at 4 this afternoon. I am still as dead as can be with the Ultra Numb, okay? Shaz, will you get an Ultra Numb out? I'll show the girls. It's in that.
Yeah, we'll show them.
Yeah, okay. Anyhow, it's a smaller tube, but if you buy 3 of them, it's the same price as the big tube. It just means they're just smaller tubes. Okay, so then, but now, F&E have now sent us the F&E Plus. So F&E have gone one step further as well. What is that? The Ultra Numb. Okay, so this is the Ultra Numb. 3 of these is equal to 1 of these, and 3 of these is cheaper than the F&E. So this one stayed numb until 11 o'clock that night. Okay, this one, the light was back in 3 hours. But they felt the same when I did the treatment. Sorry? Okay, so now F&E Plus, again tested. Okay, and what I found with F&E Plus, I haven't tested it on my own cheeks. I believe the light will come back after 2-3 hours, where this one lasts for another 2 hours. Okay, but now I've just finished a training school with permanent cosmetics. So with my students, I said on one side, I want you to use F&E cream with no gel, with no numbing gel, with no Duracane or feel better now. I don't want to use, tag. So just please, I want you to do her eyebrow with just this and with the new F&E Plus, okay? And because I find with F&E now, I don't use the gel at all for eyebrows or anything, maybe just for eyeliners, okay? And the clients were saying that this one, they would start feeding a bit eventually, but this one they never felt.
The Ultra Numb.
Not with the Ultra Numb.
Oh, yeah, F&E Plus.
So I was using the F&E.
It's got a more of a gel consistency.
Yeah.
So it's
It's
like a
more
mix
like a honey
between your pre and
consistency.
your during.
It's got more of a honey consistency. You can see it's different. So, but I used F&E, and we all did students to use FNE on the right brow, and we use the FNE plus on the left brow, and like every single client said, this one was number than this one.
How many minutes did you leave it on?
I leave on, for permanent makeup, I leave it on for about 30 minutes. And then we open up with the O2 needle, which is just a very shallow needle, just to get that epidermis open, and then put it on again, leave it on for another 3 minutes until we're at our 1 millimeter. So we just go 3 stages, O2, 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 1 millimeter needle. And then we can start working. So we never even use the Feel Better Nows, the gels or anything. We just work with the FNE.
So you put it with the open skin then?
Open skin, yeah. No, the closed skin and open skin.
Listen, I've used the ultra numbs
Yeah.
just by accident on an open skin as well.
Yes, you can.
It was so, but I didn't know that. I thought it was only for the first
Yeah.
Wherein she was so numb.
Yes.
It worked like
Now,
magic.
normally the creams don't work on open skin, the FNE and ultra.
I think it's fine for all the areas of the face, the eyes. I would be cautious. I don't know.
I use it on the eyes.
Yeah.
I use it on the eyes, but I don't keep putting it back on the eye.
no,
I only use it on the eye to numb, and then I'll go to my gels, because we know they can't give a full abrasion. But on my brows and my lips, I'm just using this now. I'm not even using the gels anymore.
Well, you're not supposed to say that because I need to sell the gel anesthetic as well.
Sorry, can you cover them with plastic?
Yes, I covered it with plastic.
Yeah, we'll show you tomorrow. We're gonna.
Okay, so girls, I don't think you're going to find much better than this anyway. I know there's so many other brands out there that say, oh no, I use this and I've been getting it in a big tub, but I promise you I've got all those, I've got them all, and I've tested all of them because we want the best in us. We need, you and I need to be working with the strongest and the best. And I haven't found something to beat this yet. So the ultra numb, all this, I think, plus it has the youngest kid on the block, not if it even more, but if it plus.
Yeah. Okay, we better stop.
Yeah, no.
Okay. Okay.
Sorry, this is Anka's.
Good. So the procedure is quite easy. You numb the area, which is very, very important. It's very important to get a good numbing product, because if the area is not numb, it's going to delay the procedure a lot, and it takes a long time. It's not a nice experience and so on. So it's very important you get a good numbing product, especially if you can get something that doesn't require occlusion. That is to say, you don't need to put the plastic on, you just leave it there, and then you go, the area is numb, you don't feel anything. It's beautiful. You can actually work really, really well. And then with our device, normally what you do, you place the device at highest power setting, you just burn it really, really quickly. It takes almost nothing, especially if you've done it before. And then when you keep rubbing it, and then as soon as you see that it's almost flat, you lower the power setting up until it's flat, completely flat, and you usually get seamless results. With moles, it's extremely easy to get seamless results, extremely easy. Especially if and then yes, so the scar-free results are very, 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 very likely. If not, it's normally due to poor aftercare infections and so on, especially if you have leveled off the area pretty well.
So Andreas, if you do a good enough job and you go deep enough, it won't grow back.
It depends on what mole it is. Say, for example, because I know what xanthelasma are. I know really well. And I know the physiology of these xanthelasma. But if you're dealing with xanthelasma, you're just leveling them off, you may require other treatments to remove them completely. But most moles are quite superficial, so if you just level them off, you pretty much, normally you get very good results. Extremely good results.
But moles can grow.
I've had 2 moles removed, but they haven't come back at all.
Right.
Yes.
But they can come back if you maybe just
And
do it next time.
Yes,
before you eat.
and it doesn't mean that they're non-benign or cancerous. It does not mean that. However, that's the main important point. This is why it was at the beginning. It's very important that you get that part covered. Very important that you only work on benign moles, something that is not cancerous. The aftercare is pretty simple. Once again, keep the area clean, disinfect it once a day, twice a day. Don't put any plasters on Then, when the scab form, which is normally after 3 days, make sure that they don't actually, that you don't scratch it. Just tell your clients that. It should be on the consent forms. And then the area is normally pinker when the scabs fall off, and the area should look quite seamless a few months after.
When you say don't put any plasters on, a lot of people have got moles in areas where the clothing then shaves it once you've removed it.
Mm-hmm.
Can you put something on
Yes,
it?
only in that case, because the problem with occluding something is the bacteria tends to grow more quickly. That's the problem, but only in those cases, because if you get in the belt line, you can get some rubbing in that, and that's not good. Only in those rare cases. Other than that, no. Because again, the occlusion, when you put plasters on, or plasters, unless strictly necessary, don't do it, because the area gets occluded, lots of moisture, and that facilitates bacteria to proliferate and all that.
If you're going to cover something, you use micropore.
They can breathe.
Micropore, you can even put the cream or aftercare treatment on the
Just
micropore.
a lot of clients are developing allergies towards the micropore glue on it, unfortunately.
Yeah, but those that can have micropore, rather just micropore should be soft. Yeah, gauze.
And after moles, when it's break for lunch.
Sorry?
1 o'clock.
After moles, when it's just break for lunch.
Oh yes, good, okay. So again, this is a before and after, 2 years apart. In this case, as you can see, the mole didn't grow back. This is what you usually expect. We've seen moles growing back, not often, but they can, depends on the type of moles that they are. It doesn't mean that they're cancerous, but yet, very important, that you make sure that they're not. Or you just get that part, there's something there, there's not there. Okay, yes. Basically, this is one of the case studies that you mentioned before, and you can watch the video where I've removed that. I've done it myself, very, very quick. This is the picture before the scabbing took place. 14 days later. There's a mole in there, here, in this area. And then 14 days after, still some traces. 10 weeks after, nothing. And this is what you would want to find. And then, as I showed you before, we've got the scalp. We've got several others, but in this case, so I'm not going to spend too much time, because you've seen it before, and you've got 14 days, you could still see something. This is 10 days after, 14 days, the scab fell off, you can still see something. 10 weeks after, nothing. And again, this very nice gentleman walked out without any head shaving or anything of the sort. Very easy. Especially if you've got long hair, it's a great thing to remove, using electrical arcing or plasma. And very, very easy. The aftercare, in this case, shampooing once a day, just making sure that the area is kept clean. Don't wear the helmet if you have a motorbike, this sort of thing. Just make sure that you don't use occlusion. And that's pretty much it. Any questions?